Okay. I'd like to introduce our next speaker, Dr. Izzeldin Abuelaish is a professor of global health in the Dalla Lana School of Public Health at the University of Toronto. He is a Palestinian Canadian physician and an internationally recognized human rights and peace activist. He will discuss how hatred is a characteristic of a contagious disease and how this therefore must be studied. So welcome, Dr. Abuelaish.
Thank you so much. It's my pleasure. Thank you so much. It's the second day of Ramadan and hope these days to be blessed days.
Yes, right.
So I will speak about this topic, deconstructing hatred as a contagious disease, a public health emergency threat, and a determinant of health. So the objectives of this interaction, why do we want to study hatred? And what is hatred? And what are the triggers, causes, and underlying factors for the development of hatred? And how can we use the medical model for the study of hatred? So my interest in the study of hatred, I am an obstetrician gynecologist. I am a medical doctor. I never thought one day of writing or speaking or studying hatred. But stories and our life experience shapes our future and the present and where are we going. And the stories, they have a meaning and they can trigger an action in us. I remember I wrote my book after what I experienced as a Palestinian and with the killing of my daughters, and the people were asking me, do you hate? So the answer, and this question stems out after the exposure and the experience of the tragedy. So the people, as a result of this exposure, they were expecting me to be impacted by this issue called hatred. That's why I wrote, I shall not hate, and I will elaborate more why. So we need to understanding hatred and what is going on with this issue of hatred. And you see how it disturbs the look of the human being when they are full of anger, full of hatred. So how hatred has been studied? Hatred has been studied, of course, from certain aspects, from psychological, social aspects, or philosophical aspects. But I wanted to take it a shift to another approach, determinants of health. So the determinants of health and most aspects of life depends on the context on which we live, depend on who you are and where you are. Our health, our freedom, our behavior, our education, our job, our life is determined by who you are and where you are. Even now, the impact of COVID, it depends on who you are and where you are. If you are a woman, if you are a man, if you are employed, not employed. So we need to take the context for any issue that we want to study. So why to study hatred? These days, we live in a world that the patterns of diseases and the threats are changing. And the global challenges are changing also. So humanity is at risk. No one was expecting any time that our life to be turned upside down by invisible virus. And also, the 2020 a Global Peace Index indicates a deterioration of the global peacefulness. And we need to ask why. What do we mean by a Global Peace Index? It's about the respect of the human rights, equal distribution of resources, a free flow of information, good relations with neighbors. In the time we see with COVID, we are divided and we are isolated. And also the increasing scales of civil conflicts. As a result of double standards, we live in a world with double standards, fear, fear-mongering, racism, discrimination, and even fear and fear-mongering, which are used to promote a political agenda. The incitement, you see it, the racism, the discrimination. That's why I see hatred as an urgent threat to public health and to our world and to our peacefulness. And the contagious and infectiosity of hatred. Martin Luther King said in 1958 that violence begets violence. I can say these days, hatred begets hatred also, because it's contagious. And the definition of hatred, there was no consensus on the definition of hatred till now. Some, they defined it as a negative emotion that motivates and may lead to negative behaviors with severe consequences. Hatred involves the dehumanization of the other. That's why once there is no consensus, this triggered in me, what are we going to do with this hatred? So I came to this definition. Hatred is a chronic or acute, self-community destructive, contagious disease, and is the result of exposure. So you see hatred, it's extreme, it's severe, it's a disease. It's not an emotion or behavior. It's contagious and infectious. It can be, according to the time frame, it can be chronic or acute. And also it's destructive because it disturbs the homeostasis of the human body. It disturbs the pathophysiology of the human body. It's systemic impact. If someone is impacted by it, he is paralyzed and malfunctioning. And most important, it's the result of exposure. Exposure to what? Exposure to harm. And the World Health definition, today's symposium is about violence. When we speak about violence, it's the intentional use of physical force or power, threatened or actual, against oneself, another person, or against a group or community that either results in or has a likelihood of resulting in injury, death, psychological harm, maldevelopment. And then the WHO in 1996, 49 World Health Assembly adopted a resolution that violence is a public health issue. And later on, I will speak, because violence is a public health issue, which is linked and mutually interconnected with hatred. Hatred is a public health issue. So we will speak about the overview of the current knowledge about hatred. What is hatred? The definition. Is it a disease? Is it a syndrome? Is it a disorder? Is it an emotion? And also, what are the relationships between hatred and violence? The possible causes and the risk factors. Do some people have a predisposition to hatred? And of course, the impact of hatred on health. Then hatred and health. Are there ways to mitigate the health effects of hatred? How can we develop a research agenda exploring the health effects of hatred, mitigation, or prevention strategies? So you see hatred, the origin of hatred, which leads to harmful effects of hatred. And then, of course, the outcome, reduction in hatred and harmful effects. And that's the tree, the diagnostic tree we want to adopt. The solution is interventions to reduce hatred by addressing the root causes of hatred. without addressing the root causes of hatred and taking it in a comprehensive, holistic approach, it's not going to happen. So the epidemiological triad of disease, you see it, the epidemiological triad, and we have in the middle the hatred. It's about the environment in which we live, the social, political, historical, religious, economic, educational, and cultural environment in which we live. Then the host, the gender, the race, the sexuality, the ethnicity, the socio-economic status, the nationality, the stress, the age, sexual orientation, and of course, the identity. Then the agent. The agent can be a psychological, emotional, physical, social, economic harm, discrimination. And these days, with the social media that we have, modern day weaponization of social media. Social media is a sword with double sides. It's a weapon used these days. And you have seen it even in the American elections when tweeting, and some people were upset and some leaders were upset when their accounts were canceled and stopped. Online cyber violence is creating a virtual community of hatred. That's why we need the epidemiological triad and epidemiological model of hatred. So you see the harm: physical, psychological, neglect, financial, sexual, and of course the agent. It can be non-biological agents, it can be environmental, it can be idiopathic or pathogenic, and exposure. And you see the interconnected triggers of hatred. You can see the different, we did mapping about these factors: fear, mongering, violence, intolerance, white supremacy, albinism, inequality, homophobia, sexism, different aspects. We try to collect them and to bring them, and all of them are interacting and interconnected. So you see the violence and the interconnection between violence, hatred, and health. And these days, the exposure to any harm. Number one, hate speech. And even the number of hate speech and hate organizations is increasing worldwide. In 1999, a study in the States, they have about 290 hate organizations. By 2015, it jumped to about 1,000 organizations. So you see the fear mongering, hate crime, who are the actors of this? Hate crime, the violence, the incitement, and of course, the media. So what happens once a human being is exposed to trauma? The impact, number one, it leads to poor functionality and poor quality of life. And this, the determinant factors of the impact of hatred depends on the pathogen and exposure, the magnitude, the time, the frequency, and the duration of exposure and the trauma. And of course, the host criteria, coping skills, resilience, ability to resist, physical, social, psychological, also the education, the environment, also it impacts that neighborhood, society, the nation, and the location of course, the machine and the weather in which we live. And it's a toxic, depends on the dose relationship of this toxicity. So violence and hatred, violence is the plague. It's a cause and the result. It's complicated problem, and as I mentioned, it's a public health issue. It's contagious also. Is a cause and the consequence of hatred. Even what I published, violence and hatred are mutually interrelated and interconnected. Violence and hatred at the same time, they cross barriers and borders, as coronavirus and COVID, which started in one place and spread to the whole world. So we see the ecological model at the individual level. what are the risk factors about the individual level, poor parenting practices, marital discord, violent parental conflict, and of course, we can go through the societal rapid social change, and also poverty, high crime levels, high residential mobility, high unemployment. And also here concerning the ecological model at the individual level, the interpersonal, the community, and the societal level. These are the root causes. So we need to dig deeper and to ask why, not to ask once. And that's the diagnostic tree, to ask not once, to ask 5, 10 times why some people are afflicted with hatred or they are violent. And then it comes to the contagious, because I see it as a contagious disease, mode of transmission, once the individual is exposed to initial trigger or event. It depends upon the magnitude of this trigger, of this pathogenic agent, or physical or chemical or any agent. Then the incubation period, and then of course the threshold depends upon the human individual capacity, and it leads to the result. And of course, afterwards, it spreads. It spreads from one individual to the other, either direct or indirect, using the vectors. It can be social media, through meetings, through interaction. So hatred is contagious. It spreads either direct or local, through hearing, through seeing, through feeling, through words, communicating. So it leads to distant metastasis. And these days, as I mentioned, the social media, it can spread everywhere, viral, and it can be contagious. So the impact on health and well-being, the pathophysiology. Number one, the balance, the equilibrium, and functionality are completely disturbed. It has a multi-system effect: physical, mental, psychological, spiritual health, and social health. So any pathology, it leads to disturbance of homeostasis. And hatred, it causes stress, cardiovascular diseases, endocrinology, the immunology, the metabolism, and any stress, it decreases the immunity of the human body. So you see here the impact, it causes disturbance. Hatred is associated with severe health diseases. Hate speech causes a rise in a clinical anxiety level, disrupting the immune system and allowing, of course, growth of cancer and the chronic inflammatory diseases. Negative emotions such as depression, anxiety, anger, and hostility contribute to the mortality and morbidity. Hatred is very stressful, and you can take this stress with all the consequences of stress. Of course, as I said, stress impacts immunity, cardiovascular, endocrine, and all the human systems. Chronic pain, it leads to frustration, depression, suicide, or either to adapt or to be resilient. And it leads to social suffering as a result of pain. And of course, we need a metric to measure this suffering or pain and to have indicators. And this motivated me to do a research and a study, and we are in the process to finalize it. We collected data from 800 participants from conflict zones where they are exposed to conflict and to harm. We collected the data, we did data entry analysis, and we are planning now in the final steps to develop a medical model scale to measure hatred as a disease. I hope soon, in 1 month or 2 months, to have this scale where we can use it as a medical model, a socio-biomedical model, not just an emotion or a feeling. Victims of hatred are also at risk of elevated clinical anxiety. New data Hence that the hater also faces that risk. It's not only the one who hates, but also the hater. The psychosocial perspective has revealed a great deal about the impact of hate crime on individuals. So there are some studies even proved it. Pilot study that established a method for using cortisol and other biological markers as indicators of the physiological and psychological effects of hate speech when they listen to a hate speech against a certain group of people and they took parts of the saliva. Of course, the markers, cortisol levels were increased. And then another study, when people were faced with just photos of people they hate, and they did scanning for their brain, they found a hate circle, and there is a change in the brain once they were exposed to the context of hatred and seeing the people they hate or they did harm to them. So when we speak about health, we don't want to take things in a superficial ways. And in medicine, we are not dealing with diseases. We are dealing with the human beings, with individuals in a comprehensive way. So Maimonides said, the physician should not treat the disease, but the patient who is suffering from it, and even the environment and the context which led this patient to be sick. So it's time to treat the patient rather than the disease. So prevention and management, treating people, not diseases. So we need social innovation and biomedical innovation, a novel solution to a complex social problem that is more effective, efficient, sustainable, or just than current solutions. Social innovation is the process of developing and deploying effective solutions to challenging and often systemic social and environmental issues. And that's what are we looking for and are we adopting. So the role of public health sector in disease prevention. We need to invest in hatred prevention and management, education, eradicating poverty, and promoting equality and inclusiveness. So we use the public health approach, the primary prevention, which is early age at the school, at the children, secondary prevention through screening of people and communities, and the tertiary prevention through prevention and mitigation of hatred. And we need to bridge the gap in the research and the knowledge. What do we know about hatred and what is needed to be known about hatred? Not to keep moving in a vicious circle around ourselves as if it is just social feeling or emotion. So to prevent hatred, we need to start research and education and to find if there are ways to mitigate the health effects of hatred. How can we develop a research agenda exploring the health effects of hatred? So we need screening and the prevention opportunities. So what can be done? Detection and the prediction and the prevention in high-risk individuals, the most vulnerable people, communities, neighborhoods, communities and neighborhoods, people who are socially marginalized, challenged. We need to ask why are they marginalized and who is doing it. We need to point by the finger to the challenge. Will we ever eliminate emerging infectious disease? You see, at many pandemics, we succeeded to get rid of them, but why not? We can't face hatred, which is behind many of the challenges we are facing. So hatred mitigation is to help individuals already suffering from hatred through learning and practicing cognitive reprisals, emotion regulations, and conflict resolution. We need to manage. We may not be able to eradicate hatred, but we can manage hatred. We can't eradicate chronic diseases. We manage hypertension. We manage diabetes. So here, once the people are afflicted with hatred, we can manage it. And we need at the same time to reduce hatred from the origin by preventing the triggers and, of course, finally eliminating the hatred. This is a paper I published. Is there a cure for the disease of hatred? Of course, I think if there is a will, there is a way, but we need certain steps to take action. So the conclusion and recommendations. That's my conclusion. Hatred is infectious and spreads or crosses barriers. Hatred is the result. Hatred is a disease and not emotion. Hatred is a public health issue. Hatred is a determinant of health and depends on who you are and where you are. To redefine, that's why we are in the process to redefine hatred. In what way? In a comprehensive, interdisciplinary, multidisciplinary, comprehensive, holistic, and collaborative approach, including physical, mental, spiritual, and social. Hatred is induced or made as a result of exposure. Then, of course, hatred can manifest as a contagious disease. The antidotes of hatred. I believe the antidotes of hatred are awareness through research and knowledge, education, resilience, tolerance, kindness, and of course, forgiveness. And this needs, of course, awareness and research, and to link it to the impact of hatred. Hatred is not our destiny. Even COVID is not our destiny and should never be eternal. And we are hopeful these days, COVID, one day it will be over. So why not also hatred not to be our destiny and to focus and to invest in preventing this destructive disease, because by the end we need to have a sense of purpose. We need to contain it and to prevent it or eradicate it. Freedom, health, well-being, justice, equality, and peace are our destiny. Maybe can we live in a world where we have a pandemic of justice, equality, equity, and the freedom? I believe once we have it and we directed our investment not in military means, not in fighting, but in bridging the gap between us, in knowing each other and understanding, and using the socio-biomedical model, because we all want to be healthy. We all value health. So I think a pandemic of justice, equality, equity, and the freedom can be the way to get rid of hatred.